Hello, I am AARP Vice President Bill Walsh, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you'd like to hear this telephone town hall in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *0 en su teléfono ahora.
AARP, a non-profit, non-partisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. As we approach the Thanksgiving holiday, the pandemic is proving once again to be frustratingly persistent. Over the past week, COVID-19 cases and hospitalizations have been trending up in about half the states as cold weather sets in and people are spending more time indoors. The good news is that the U.S. vaccination rates continued to increase, albeit slowly, and nearly 70% of Americans have at least one dose. Also, the FDA's recent authorization of the Pfizer vaccine for children ages 5 to 11 is encouraging. Yet COVID-19 related misinformation continues to spread, stoking fears and confusion, particularly among older adults. And as families prepare to gather for the holidays, many are turning their attention to the health and mental well-being of their loved ones and family caregivers. Today we'll be talking to a very special guest, Vice Admiral Vivek Murthy, MD, U.S. Surgeon General, to discuss these issues and more. If you've participated in one of our teletown halls in the past, you know this is similar to a radio talk show, and you have the opportunity to ask your questions live. For those of you joining us by phone, if you'd like to ask a question of Dr. Murthy, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you're joining on Facebook or YouTube, you can post your question in the comments. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion about the global coronavirus pandemic. We're talking with the U.S. Surgeon General, Dr. Vivek Murthy, and taking your questions live. To ask your question, please press *3, and if you're joining on Facebook or YouTube, you can post your questions in the comments section. We'll also be joined by my AARP colleague, Salinas, who will help facilitate your calls today. This event is being recorded, and you can access the recording at aarp.org/coronavirus 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staffer and get in the queue to ask your question live. Or if you're joining on Facebook or YouTube, place your question in the comments. Now I'd like to welcome our distinguished guest, the U.S. Surgeon General Vivek H. Murthy, M.D. and M.B.A. Dr. Murthy is the 19th Surgeon General of the United States. His mission as the nation's doctor is to restore trust by relying on the best scientific information available, providing clear, consistent guidance and resources for the public, and ensuring we reach our most vulnerable communities. Welcome and thank you so much for joining us, Dr. Murthy.
Well, thank you, Bill. I really appreciate you having me on today.
All right. Well, we're delighted to have you. Let's dive right in. In the first week it was available, some 900,000 children ages 5 to 11 got COVID vaccines. Still, many parents and grandparents are weighing the risks and the benefits. And even some fully vaccinated adults are struggling with the decision to vaccinate young children. Why do you think that is, and what can you say that would give them some confidence in the vaccine for kids ages 5 to 11?
Well, that's a great question, Bill. And I'll just say, even though I'm the Surgeon General and I'm a physician, I think about this first and foremost as a dad. I'm a parent to two young children who are under the age of 12, which means up until recently, there hasn't been a vaccine available for them. And my wife and I, when we were thinking about this decision, we wanted what every parent wants, which is to make sure that our kids are safe and that they're protected. And so I certainly think if parents out there, if grandparents out there have questions about the vaccine, that's perfectly okay. It's reasonable. You just have to get your questions answered from credible and reputable sources, because there is a lot of misinformation out there. A few things I would say, though, to parents and grandparents who are considering the vaccine for their kids and grandkids. Number one, it's important to know that the vaccine that's available for children 5 through 11 is specifically designed for kids. It's a lower dose than what the adults get. It's about a third of the dose. And the clinical trials that were done to study the impact of the vaccine were also specifically designed for kids in the 5 through 11 age group. And the thousands of participants in those trials helped us understand two critical things about the vaccine. Number one, it's highly effective in preventing COVID-19 in kids, more than 90% effective. And the second is that it has a really strong safety profile. There were no serious adverse effects that were seen among children. When they did experience side effects, it was soreness in the arm, fatigue, headache, a fever that lasted for a day or two, but then resolved, leaving children with protection. There's one last thing that's important, I think, to consider here, too, which is the consequences of not getting vaccinated. We've been through quite a lot, all of us, with this pandemic, and it's still not over yet, unfortunately. We made a tremendous amount of progress with nearly 195 million people fully vaccinated now in the country who are protected from the worst outcomes of COVID. But we still have many who are not vaccinated, and those include our children. Now, as winter approaches, we're seeing cases starting to go up, especially in cold weather parts of the country. And that's not surprising, because as people go indoors, there's a greater chance of spread indoors. And we also know that the virus is more easily transmitted in cold, dry air. But that's why it makes it all the more important for us to strongly consider getting our kids vaccinated now, because, we don't want them to be subject to infection and to risk from COVID over the coming weeks. And we have a chance, if we start now, to start their protection early. Last thing I'll just say is this, timing-wise, if you get your child or your grandchild, if you start that vaccination process this week, you can actually have you have him or her ready, actually, and fully vaccinated by Christmas time. Which I know for my family, we're planning to take our kids to visit their grandparents during the Christmas holidays, and we're really excited for our son to be fully vaccinated for that.
That's a great point. I think travel during the holiday season is on everyone's mind. Let me just follow up very quickly. Which vaccines are now available for kids ages 5 to 12? And also, you noted that the kids' vaccine was a lower dose than the adult, but how does it compare to the one that was approved for kids 12 and older?
Well, that's a great question, Bill. Well, the vaccine that's available for children 5 through 11 is the Pfizer vaccine. Some out there may know that there are 3 vaccines available now in the United States, one made by Pfizer, another made by Moderna, and a third made by Johnson & Johnson. So this is the Pfizer vaccine. It turns out that the Pfizer vaccine is also the vaccine that's available for children 12 and up. But the dose for kids 12 and up is higher than the 5 through 11 dose. In fact, the dose for kids 12 and up is the same as the adult dose. So again, the current vaccination that was announced for children 5 through 11, this is specifically designed for this age range.
Okay, thanks for that. Now, you alluded to this earlier. Many families' grandparents help keep the families healthy and whole, through childcare, tutoring, financial support, or other guidance. But it can be really delicate to discuss some parental decisions like vaccines. Do you have any advice to offer grandparents?
Well, absolutely. And I know sometimes this can be delicate to navigate, especially when you're trying to be helpful, but you don't want to overstep the parents' your sort of decision making. Look, as a parent myself, we negotiate this all the time with my parents, with my kids' grandparents, as they participate in some of the decision making that we make for our children's health. So it's not always easy, but here's one thing I do know. Like during this time, we've asked so much of parents. So much has been foisted upon them. They've had to not only be parents, but they've had to become teachers, as distance learning was required for many kids during the pandemic. They've had to, telework, many times in the process and figure out how to do all that. They've had to take care of so much more than is usually on their plate. And that's been taxing. And so any help and support in making decisions, getting information, I think can often be quite a service to parents. But here's a couple of things I would recommend. One is to approach the conversation, just with an ear to listening. A lot of people may have heard various things about the vaccines, they may have questions, may have concerns. Trying to understand what the parents' concerns are is one important part of it. I think the second is to try to gently and empathetically raise your concerns or your suggestions. If you're concerned about your grandchild's exposure to COVID-19, especially if they're going to be traveling for the holidays or if they're in communities where there's still a lot of spread of COVID-19, and being able to gently share those concerns, but also direct parents to credible sources of information is also very important. And there are a number of credible sources you can point parents to. Those include talking to their own doctor, going to their local children's hospital for advice, talking to their local Department of Health, going to the CDC website. There are places that are science-based that can provide people with answers to their questions. And finally, I would just say this also. Sometimes it's a really interesting thing about all of us as human beings, our psychology. We tend to overweight the cost of action and underweight the cost of inaction. And the reason that becomes relevant here is sometimes we might not think there's a cost to waiting to get vaccinated, but there actually is a cost. And we know, for example, with a lot of COVID around, and there are somewhere between 75 to 80,000 people who are getting infected every day in this country. That's a lot of COVID-19. It means a lot of people who are potentially exposed as well. The risk to our kids is not negligible. In fact, during this pandemic, we've lost hundreds of children to COVID-19. We've had thousands of kids who have been hospitalized. We've had thousands who have developed something called multi-system inflammatory syndrome, which is one of these conditions where multiple organ systems, including the heart, are affected. And beyond all of that, we know that COVID has forced many of our kids to miss play dates and time with grandparents, caused them to miss school, as well as youth sports. So the cost to our children has been substantial. So just because children overall do better than older adults when it comes to COVID does not mean that COVID is harmless in them. And if anyone tries to sort of tell you that just COVID is just the flu or just like a bad cold, it's absolutely not true. We've learned that the hard way through a very, very difficult experience these last 22 months. So those are some things that might be worth raising with parents. But I do think, and I want to emphasize this, I do think grandparents have a very, very important role here to play. I know many of them out there have played extraordinarily important roles during this pandemic in providing so much of the support and an extra help, and not just practical support, but emotional support that many parents like me needed. I don't know if I could have made it through this pandemic without my parents, without my children's grandparents. They were an integral part of caring for our kids and making sure we had the support to make the right decisions for them as well.
Yeah, I think a lot of people feel that way. Well, thank you so much for that. Let me shift gears and talk a little bit about boosters. In these programs in the past, we've gotten a lot of questions about boosters, and hopefully you can offer some clarity. News outlets are reporting booster shot authorization will be expanded to include all adults. Can you talk about that, and also whether it's safe to mix the vaccine, say getting a different booster than the initial full cycle? Some have suggested mixing the vaccine types can actually strengthen the immune response. What are your thoughts?
Well, I'm really glad you asked, Bill, because boosters are an especially important topic right now as winter approaches. And let me just step back for a second and just talk about the purpose of boosters for a moment. Number one, vaccine boosters are not unusual. We have boosters for many vaccines that people commonly get. Classic example is the tetanus shot. It doesn't mean that the vaccine that you got in the beginning doesn't work. In fact, the purpose of the booster is to extend the strong protection that people have already been getting from the vaccine. We just want to keep that going. And we know that the vaccines have already been instrumental in saving many people's lives, preventing them from ending up in the hospital. So again, we want to continue that. As of right now, people who received the Johnson & Johnson vaccine 2 months ago or more are eligible to get boosted. People who got the Pfizer or Moderna vaccine more than 6 months ago and who fall into a high-risk category are also eligible to be boosted. And now, what does it mean to be in a high-risk category? Well, right now, that means you're either above 65, you've got other medical conditions like heart disease, diabetes, or obesity, or you live or work in a place where you're more exposed to COVID-19. Maybe you work in a hospital, or you're a teacher in a school, or you work in a grocery store. Those would all be examples. Now, if that sounds like a lot of people, it is. It's about 100 million people who are eligible for boosters right now. And I would urge anyone who is eligible to please get boosted as soon as you can, because we, especially with the winter coming, cases going up, we want people to have protection. If you're planning to travel for the holidays or get together with family, this is another layer of precaution that you can add to make sure you stay safe, but also you prevent yourself from transmitting the virus to other people. Now, finally, when it comes to the decision the FDA and CDC are working on right now, they're considering expanding the eligibility even further. So it would be all adults 18 and up would be eligible for a booster shot. And they will make that decision actually very, very soon. We're expecting it within days here. But the bottom line is there are millions of people who are still eligible who have not gotten boosted. About 30 million have gotten boosted so far. That leaves about another 70 million who are eligible. And lastly, with the mix and match, as you mentioned, it is actually now permissible to mix and match your vaccines. So if you got boosted with Pfizer, for example, and you went to get if you got your primary series with Pfizer and then you went to get boosted and they only had, let's say, Moderna, it would be okay for you to get a dose of Moderna. And similarly, vice versa. If you got Moderna and they only had Pfizer available, it's okay to get a dose of Pfizer. When it comes to Johnson & Johnson, some people have asked the question, should I go ahead and get a Johnson & Johnson booster or should I get boosted with Pfizer and Moderna because of some data from Europe that showed that boosting with the mRNA vaccines, of which Pfizer and Moderna are, a type of mRNA vaccine, that might be beneficial for folks who got a vaccine like J&J first. And the truth is there's data showing that if you get boosted with Johnson & Johnson, that you actually get boosted to a very high level of protection. There's also data showing that if you got Johnson & Johnson, then you get boosted with the mRNA, that boosts your antibody levels up to very, very high levels. So the bottom line is whichever pathway you go down, you should get strong protection from the boosters. And that's what we really want for everyone, especially going into this holiday season.
Right. Okay. Thanks very much for that, Dr. Murthy. And as a reminder to our listeners to ask your question, please press *3 on your telephone keypad. And we're going to get to those live questions shortly. But before we do, I want to bring in Nancy Lamont. Nancy is the Executive Vice President and Chief Advocacy and Engagement Officer here at AARP. Welcome, Nancy.
Well, thank you. I'm delighted to be here with Dr. Murthy and you, Bill.
All right. We're delighted to have you. Now, in addition to sharing the most current coronavirus information, we'd like to take a few minutes to update our listeners on timely issues facing Congress in a segment we call Fighting for You. This week is a big one, with a lot happening on Capitol Hill that will affect older Americans. Nancy, what can you tell us?
Well, this is a big week. In many respects, the biggest we've seen in years, with a lot to celebrate. First, President Biden signed the bipartisan infrastructure bill into law on Monday, and we're expecting the House to vote very soon, maybe tomorrow, this weekend, on the budget reconciliation package, which includes a number of AARP priorities.
Okay, so two huge pieces of legislation. Well, first, let's talk about the reconciliation package, which is also known as the Build Back Better Act. What do people need to know about that?
Well, we're urging Congress to vote yes on this package that will lower prescription drug prices for millions of older Americans by finally allowing Medicare to negotiate certain drug prices. AARP has fought hard for this, and we're happy to see Congress finally reaching a deal to tackle the skyrocketing costs seniors pay for prescription drugs. In addition to Medicare being empowered to negotiate drug prices for the first time, the bill also penalizes drug companies that increase their prices faster than the rate of inflation. And it also adds a hard cap on what seniors pay out of pocket for prescription drugs under Medicare Part D. I can't stress enough what this would mean to older Americans to finally get some relief from skyrocketing prescription drug costs.
Okay, so a lot of big news on the prescription drug front. What are some of the other provisions in the Build Back Better Act that AARP is fighting for?
Well, obviously, the prescription drug relief is a huge victory, and we simply can't overstate that enough. But as you say, there are other important health-related changes, including in the package. AARP has strongly supported the bill's addition of a hearing benefit to the Medicare program, as well as critical investments in home and community-based services, so more older Americans are able to choose how they live and how they age. We also support the inclusion in the House bill of paid leave, which will offer much-needed help to working family caregivers who are also struggling to balance paid employment and caring for their loved ones. The bill also makes individual health coverage more affordable and accessible for millions of Americans aged 50 to 64. And finally, the bill makes a significant investment in housing, which is critical to older adults who will benefit from the construction and repair of affordable and age-friendly housing options.
Okay, well, thanks for that update. Let's talk about the other big piece of legislation, the new bipartisan infrastructure bill that was signed into law this week. This includes more good news for older Americans. Can you share some of the highlights?
Sure. The infrastructure bill will help millions of Americans 50 and older stay connected to their communities, both in person and online. The package includes several AARP priorities, namely investments to expand access to high-speed internet. It'll also help us improve roadway and pedestrian safety, as well as expand public transit. Nearly 15% of older adults have no access to high-speed internet, and almost 7 out of 10 outlive their ability to drive, both of which limit their ability to access health care and jobs and stay connected in communities. AARP is fighting to ensure that all Americans have affordable, reliable internet access wherever they live and benefit from a range of safe and accessible transportation options, regardless of their age or their ability.
All right, so it sounds like a lot of positive changes there for older Americans. Is the battle over yet?
There are a lot of important positive changes, but we have to keep going, and it's going to take efforts from all of us. AARP can't thank our members enough for raising your voices. Activists sent 300,000 emails and made 9,000 phone calls to Capitol Hill within a few days, demanding that Congress make good on its promise to lower drug prices. And for those of you who are on the call today who helped us out, we really appreciate it. Your voices were heard loud and clear and are the reason prescription drug prices made it back into the bill. AARP will continue our full-court press as the reconciliation bill makes its way through the House and the Senate and completes its long and winding process to becoming law. But it's, as you pointed out earlier, Bill, it's shaping up to be a very good week.
All right. Well, thank you so much, Nancy Lamont, for that update. We really appreciate it. Now it's time to address your questions about the coronavirus with Dr. Vivek Murthy. As a reminder, press *3 at any time on your telephone keypad to be connected with an AARP staff member to share your question live. And if you'd like to listen in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *0 en su teléfono ahora.
Now I'd like to bring in my AARP colleague, Jesse Salinas, to help facilitate your calls today. Welcome, Jesse.
Thanks. I'm so glad to be here, Bill.
All right. Who do we have on the line first for the Surgeon General?
Our first question today is going to be from Ralph in New York.
All right. Ralph, welcome to the program. Go ahead with your question.
Yes, good afternoon, and thank you for having me. My question has to do with the anti-vax movement. I understand that the virus can be really put to bed by getting by a high participation of getting vaccinated against it. Yet there's so many people that are worried about theoretical or possible, very faint possibility of getting a reaction, and they'd rather not get the vaccination. Yet the cost of that is the real side effect, which could be death by not getting the vaccination. It's like misplaced priorities. So, why is it so pervasive, the anti-vax sentiment, and then what can be done about it?
Yeah. Thanks so much, Ralph. It seems some days that the only thing more persistent than COVID is the reluctance by some folks to get the vaccine to it. Dr. Murthy, can you address that ongoing concern?
Well, sure, Bill. And first, Ralph, thank you for that question. I'm thinking maybe one of our strategies should be to send you out on the road because you seem to have a very clear understanding of the trade-offs here. Because you're exactly right. It's very interesting and concerning to me how some people focus on the very, very low risks of getting vaccinated while ignoring the very, very high risks of not being vaccinated. And unfortunately, we have seen the price of that trade-off time and time again. We lost over 750,000 people in our country to this virus, which is just absolutely astounding. And we are losing more than 1,000 every day now. So clearly we have work to do. To your question about why this sentiment is as prevalent as it is, I think it's a few things that are happening. I think one, we know that there's a tremendous amount of misinformation that has proliferated during this time that's led some people to even believe that COVID's not real. I've had healthcare workers tell me that they have brought people in who are extraordinarily sick, have been admitted to the ICU, and they still don't believe that they have COVID because they've been told that there's no such thing or that it's not real. And so there's a lot of misinformation about COVID, about the vaccine, about precautions, about masks, which have led people to move in a direction that's often been counter to their health interests. There are a few things feeding this as well. I think one, we know that one thing that's different now versus 10, 15 years ago is the proliferation of technology platforms on which people can share information. And unfortunately, while there's a lot of good that comes from these technology platforms, many of them have done a poor job of understanding the spread of misinformation on their site and have unfortunately allowed an extraordinary proliferation of this misinformation. There's some tech sites, for example, some of the social media platforms, which have algorithms which inadvertently serve up more and more misinformation to people if they consume an initial article that may not be, reputable, may be false, because the algorithm tells them, hey, they like that article, they read it, maybe they should get more of it. So you can see how this can become counterproductive very quickly. But there are a couple of other factors at play here as well, Ralph. One is the fact that we are living in a time of extreme polarization. And the reason that matters is because polarization, whether it's political polarization or polarization for other reasons, actually enables the spread of misinformation. Because when people become distrustful and angry towards those who don't share their belief or life experiences, we can find ourselves looking to believe anything that proves the other side is wrong, even if that information is false or if it's misleading. And so that's why it has been seen time and time again that polarized environments are fertile ground for misinformation to spread. And then last thing is just fear, Ralph. This is a time where a lot of people are worried. They're seeing what's happening with regard to health and the impact on our kids, on our schools, on our economy, and they're worried. And when people are fearful, that's also a dangerous time when misinformation can take root, because some people will take advantage of that fear and will try to sell people a narrative that may or may not be true, but may be economically beneficial, to the person disseminating that misinformation, or politically beneficial. So, it's a complicated and unfortunate environment. But here's one thing that gives me hope, and something that we've seen time and time again, which is that what can break through a lot of that is when people hear information from sources they trust. A lot of people may not trust the government, they may not trust a large company, but they may trust their doctor or the nurse who takes care of them, or a family member who's well informed, or a faith leader from their congregations every Sunday. These trusted voices have extraordinary impact and outsized impact right now, which is one of the reasons why one of the things I've been working on that we have been building here in government is something called the COVID-19 Community Corps, which is a consortium of more than 16,000 churches and synagogues and YMCAs, local and sort of state level networks, as well as doctors, nurses, and other organizations that are coming together because they want to do everything they can to make sure people have accurate information about COVID-19. So anyway, right. I just want you to know, Ralph, that you as an individual, all of us have people in our life who trust us. That means we have power through our voice and the power to help get them accurate information. That's what's going to take for us ultimately to break through that misinformation and end this pandemic.
Okay, very good. Thank you, Doctor. Jesse, let's take another question.
Yep, we've got a lot of responses in social media today, Bill. So our next question is from Luann on Facebook, and she asks, what percentage of fully vaccinated people are having breakthrough cases of COVID?
Can you address that, Dr. Murthy, the rate of breakthrough infections?
Sure. So one of the things that we started seeing is, well, in the original trials, what we saw was that the vaccines were highly effective. In fact, in the case of the mRNA vaccines, Pfizer and Moderna vaccines in particular, they were more than 90% effective at preventing infection. What we started to see as time went on is that it was a combination of waning immunity, meaning that after about 6 months, we saw the protection of the vaccines was starting to go down a bit. But we also saw that with the Delta variant, that there were more breakthroughs. And the Delta is the latest version of COVID-19 that caused the surge that took place over the summer. But here's the really good news. We found, number one, that the vaccines have still, by and large, been very effective at preventing people from experiencing the worst of COVID, and those include hospitalization and death. So bottom line is it still saves your life, keeps you out of the hospital. But we also found that with boosters, you can restore that high level of protection even against mild to moderate infection. And that's one of the reasons that we are strongly recommending that people who are eligible get boosted. Again, 100 million people are eligible right now. Anyone who got J&J more than 2 months ago, people who got Pfizer and Moderna more than 6 months ago, and who fall into a high-risk category above 65, have other illnesses, where they live and work in a place where they're more exposed to COVID-19.
Okay, Jesse, who do we have up next?
I'm going to take one more from social media. We've got somebody named Lisa Spirit from YouTube, and she says, my 9-year-old grandson is not vaccinated. I want to know if I can see them over the holidays. Do they need to take a rapid COVID test on the same day they're coming to my house, or what do you suggest?
Doctor, what do you suggest? Lisa wants to visit with her 9-year-old grandson.
Oh, well, first of all, I'm so glad, Lisa, that you're going to have a chance to see your grandson. My kids are going to be able to see their grandparents over the holidays. I'm very excited about that, too, and they are as well. So a couple of things you can do to make sure you're safe. If your 9-year-old, for example, is coming to visit, keep in mind your 9-year-old now has the chance to get vaccinated because we have a vaccine for 5 through 11-year-olds. And so getting him or her vaccinated as soon as possible would be the most important thing I could recommend. Second thing I would say is you can absolutely use testing as a way to reduce your risk even further. And so testing, for example, on the day that your grandson arrives would be one way to help reduce risk. Is testing 100% reliable? No, but is it pretty darn good, at helping us understand if somebody's got a high level of virus in them? Yes, it is. So I would certainly get them tested as well. And I would think about your circumstance as well. If you're above 65, if you've got other medical conditions like diabetes, obesity, heart disease, lung disease that might make you feel that you're at higher risk, then you can also go the extra mile and make sure you're wearing masks when you're in indoor settings together. And if you need to be indoors, let's say to eat, then trying as best you can to improve the ventilation. Having a portable air filter there, having other means like opening windows, etc., to improve air circulation is yet another way to further reduce risk.
Okay, great tips there. Jesse, let's take another call.
Yep, we're going to bring on Donna from Ohio.
All right. Hey, Donna, welcome to the program. Go ahead with your question.
So if you have had COVID and you got a vaccine 3 months later, do you still need to get the booster shot?
Dr. Murthy?
Well, Donna, that's a great question. So if you had COVID and then you got back a vaccine dose 3 months later, you should have a good degree of protection against the virus, which is great. But what we're recommending is that if you are more than 6 months out from your last shot, and if you got, for example, let's just say you got one of the mRNA vaccines, Pfizer or Moderna, if you're more than 6 months out for your last shot, we're still recommending at this time that you get boosted if you fall into one of those higher risk groups that we talked about before, over 65, you've got other illnesses, or you live or work in a place where you're a higher risk for getting COVID. So I would still recommend doing that. Again, the risk side effects of these vaccines are the risk is very low, the benefits are very high, especially with winter coming, holiday gatherings coming. It's a good time to have that extra protection.
Okay. Thanks to our listeners and those of you on Facebook and YouTube for your questions. We're going to get to more of those questions soon. And remember, if you'd like to ask a question, go ahead and press *3 on your telephone keypad or drop it in the comments section on Facebook or YouTube. Also, if you'd like to listen in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *0 en su teléfono ahora.
Dr. Murthy, we've seen a lot of news recently about a surge in COVID cases abroad. Cases in Europe have surged about 50% over the past month. And, as I said at the outset, rates are also up in this country. How worried should Americans be of rising cases abroad? And is the increase in this country likely to continue?
Well, it's a really important question, and one thing we've seen is that what happens in other countries, in other parts of the world with COVID, ultimately has an impact on us. This is a global pandemic, and it's emphasizing and reminding us how interconnected we are. I think as winter approaches, there are a couple of things we have to keep in mind in the United States. One is that we are starting to see a rise in cases, and we should anticipate that may continue for some time. How bad it gets, how much it rises, really depends on us and what we do together over the coming days and weeks. Now, what is driving this increase? Well, it's a couple of things. Number one, it's the fact that we're getting to cold weather season, and when the cold comes, people go indoors, and indoors is a perfect setup for the virus to spread. The other factor is that in cold, dry air, it's easier for the virus to spread, so that's also contributing. And finally, keep this in mind. We know that for people who got vaccinated a while ago, that one thing that may be contributing here is some waning immunity, which is why we're encouraging people to go out and get a booster shot if you are eligible for one. And if you are not vaccinated, this is absolutely the right time to get vaccinated as quickly as you can, because you have no protection really if you're not vaccinated. Of course, you've got your natural immune system, but we've seen how many people have had severe illness and have died from this virus over the past couple of years, almost a couple of years now. So the bottom line is cases may continue to go up for some period of time this winter, but if you get vaccinated, and particularly if you get boosted, you can give yourself a high degree of protection, certainly against the worst outcomes like COVID, like hospitalization and death.
Right. All right. Thanks for that, Dr. Murthy. Now, next week, of course, families will be spending time together around the dinner table. And, historically, this is an opportunity to take the measure of the health of our family members, in particular aging loved ones. What should we be looking for? What questions should we be asking?
Well, Bill, I think this is such an important topic that we don't discuss often enough, which is the fact that this pandemic has taken a real toll on our mental health and our emotional well-being. We focus so much on hospitalizations, on other physical aspects of COVID-19, but gosh, I worry most, or just as much, I should say, about the mental and emotional toll on all of us. And this is not always easy to see, right? You can't always tell from what people post on social media or from the brief conversation you may have over the phone about how people are really doing. So if you have the opportunity to get together with family face-to-face, an experience which I think we appreciate even more now after the many months of this pandemic, I would certainly use that as a chance to really check in with people and to ask how they were doing. Now, when you say, how are you, 99% of the time, people don't give you the honest answer. Sometimes you got to pause, you got to wait, you got to listen for the real answer. Sometimes you got to dig a little bit deeper. But this is a time for us to remind people that they have people in their lives who care about them, who are there for them, who are willing to listen to them, and who are there to support them. One of the things we can also do is to be open about how we are doing. Sometimes a moment of honesty or transparency from us can inspire others to be open and honest as well. I would say, before you leave and come back home, make a plan to stay in touch on a regular basis. It's great to get together once a year for the holidays, but sometimes it's that 5-minute call in between that's done on a regular basis that can really provide a lifeline for so many others. When it comes to strengthening our relationships with each other, something that I think this pandemic has reminded us that we have to do because our relationships are our lifeline, it turns out that it is the quality of time we spend that really matters, not the quantity of time alone. And that 5 minutes of conversation where we're truly present with someone, where we're listening undistracted by our phones or other devices, and we're showing up just to truly understand how they are, that could be more powerful than an hour or 2 hours of distracted conversation. So it turns out at the end of the day, when we look at the number of wounds people have sustained during this pandemic, I want to remind everyone that we all have the power to help each other heal simply by showing up, by being present, and by lending our support.
Yeah, I think it's a great point. Some of the less visible concerns of this pandemic have been the most insidious. And one of the most insidious has just been, the burnout. I mean, I'm sure you've seen it in the health community among medical and health workers. We've seen it a lot in family caregivers. Their jobs were difficult enough pre-pandemic, and they've gotten even more challenging during the pandemic. Do you have any advice for them, some tips or best practices to help take care of themselves?
This is such a real cost of this pandemic, the burnout that you mentioned. In my own family, my grandmother is 90 years old, and my mother is the primary caregiver, with some help from my father and my sister. And I look at the toll on my mom and on the family, over this past year and a half of not having no external help, just having to be there day in and day out and take care of my grandmother who's had a number of health problems. And that burnout's real. I see it up front in my own family, and I know millions of others are experiencing this as well. I think if you're one of those people out there who's struggling with this kind of burnout, a couple things I would offer. Number one, please know that you are not alone. The fact that you may be feeling burned out doesn't mean that you are somehow weak or that you can't rise to the occasion or that you just don't have what it takes to care for your family. What you're going through is a very real and understandable phenomenon that many other people are going through during this pandemic. You've been asked to do an extraordinary amount, and I want people to know that. The second thing, though, is just to remember that one of our most powerful sources of healing is our connection to one another. It's our relationships. And we might think, gosh, with the burdens of caregiving, I just don't have time to go visit other friends or to have that 1 hour catch-up conversation. And that's very real. But the good thing about the fact that we are hardwired to connect with one another is sometimes even just a few minutes on the phone or via FaceTime with someone we care about, that alone can give us a significant boost. But it requires us to take that 5 minutes to be fully present and not distracted during those conversations, and to just allow ourselves to be open. But the returns can be absolutely amazing. And the last thing I'll point out is just that moments of solitude can also be very renewing for people who are struggling with anxiety, with depression, with burnout from this pandemic. And now, this might be counterintuitive because I just said that relationships and social connection is very powerful for healing. But solitude is very different from loneliness. Solitude is the time we spend by ourselves where we're at peace, where we're calm, that it's a time that renews us. And that might be 5 minutes that we spend sitting on our doorstep, feeling the breeze against our face. It might be a short walk that we take through the woods, in our house, near our house. It might be 5 minutes we spend listening to music that calms us or inspires us, or reading something that reminds us of who we want to be. However we spend those few minutes, whether it's praying, meditating, reading, listening, taking those 5 minutes is something that I would encourage everyone to do, whether it's at the beginning, end, or middle of your day. It's not being selfish. It's doing what you need to do to support and sustain yourself during a very, very challenging time.
Right. Okay. Thank you for that, Dr. Murthy. Now, I have another question for you. Maybe it's an unanswerable question, but I know it's on the minds of all of our members and many people around the country. It's, how does this pandemic end? What are the milestones that tell us that, we're moving beyond COVID's grip?
Well, that is the right question. And one thing I do want to tell people is that we have made tremendous progress over this past year and a half. I know it may not always feel like that as you read the headlines in the paper and you see that there's still thousands of cases that are taking place a day. But here's what I would keep in mind. Like last year at this time, we didn't have a vaccine that was available. We were seeing cases surging and being followed by hospitalizations and deaths rising at an extraordinary clip. And we didn't have really powerful oral medications also that were game changers. But here's where we are now. We've got not only one, but 3 vaccines. We have 195 million people who are fully vaccinated. It means that 195 million people are protected against the worst outcomes of COVID. We've got now 28 more million people in our children, 5 through 11, who are eligible for vaccines. We've got our kids back in school. We're learning how to actually gather for the holidays. And we've got 2 oral medications that can be taken by mouth that are on the horizon, that are going through the FDA review process, but have been shown to dramatically reduce your chances of getting seriously ill if you get COVID. All of this is really good news. But for this pandemic to end, here's what we need to see. We need to see the severity of COVID dramatically reduced. And we can do that with vaccines and oral medicines. We just need more people to get vaccinated. We've got about 60 million people in our country who are eligible but not yet vaccinated. We need to close that gap. The second thing that we need to see come down are the sheer number of cases. And there, too, we can reduce those cases as we get up there in terms of our vaccination rates. And if we continue to take precautions judiciously, especially when case levels are high, and those precautions include things like wearing masks when we're when outside our homes and indoor settings. So these are the ways that we can get there. We will get there, though. This pandemic will end. That doesn't mean COVID will 100% disappear, but we will learn to knock it down so that it's far less dangerous to us than it is right now. And we see the tools to do that on the horizon. So all of that just to say that as tough as things are, I am hopeful that we and optimistic that we will get to this end of this pandemic, and I'm more confident in that now than I was a year ago.
All right. Well, we all very much appreciate your optimism. Now it's time to address more of your questions with the U.S. Surgeon General, Dr. Vivek Murthy. As a reminder, press *3 at any time on your telephone keypad to be connected with AARP staff to ask your question live. Jesse, who do we have next on the line?
Yep, our next caller is Leonard from Arizona.
Hey, Leonard, welcome to the program. Go ahead with your question.
Nice to talk to you, Dr. Murphy and Nancy Lamont. I have a question about this. 85, my wife's 79. We had our Pfizer shots in January, second shots in February, boosters in September. Can we expect that we will be getting a COVID shot next year and every year after, consistent with what we do with the flu and not with what we've done with other diseases like we got for childhood immunizations?
Right. Thanks for that question, Leonard. Dr. Murthy, this is a question on a lot of people's minds. Once they've gotten their regimen of shots and boosters, what can they expect in the future?
Well, Leonard, it's a really good question. And first of all, I'm so glad that you and your wife got vaccinated early in the year and that you got boosted in September. That means that you have a high degree of protection now against the worst of COVID. That's great news going into the holidays. As to whether you're going to need another shot next year or not, the truth is we don't know yet. What we have to do is continue to follow people like you and understand more about what their experiences are as the months progress. But if we do see any indication that protection is dropping, that might be a signal that people do need an additional shot. And so it might end up being like the flu shot, where you may have to get something, a booster every year. Or it could end up being like the hepatitis B vaccine, where you get 3 doses at 0, 1, and 6 months, and then you're good for many years. But time will tell which course we go down. But this I can tell you, if it turns out that regular booster shots are needed, we will have the supply to do that. We will have the mechanisms to deliver it, because that's what we've built over this past year. Tens of thousands of locations for people to get vaccinated, the manufacturing capacity to generate what our country needs for protection.
Great. Thank you very much, Dr. Murthy. Jesse, let's take another call.
Yep, we're going to take Lillian from Illinois.
Lillian, welcome to the program. Go ahead with your question.
My question is, I had the Johnson & Johnson shot. There's very little information given out the Johnson & Johnson booster in the area where I live. I am refusing to take any other booster other than Johnson & Johnson. So why is the information on the others, Pfizer and the others, given so often and Johnson & Johnson doesn't get the equal coverage?
Mm-hmm. Well, let's ask the nation's top doctor. Dr. Murthy, can you talk a little bit about progress on a J&J booster? And also, you talked earlier about mixing and matching booster regimens. Can you address that again?
Absolutely. Well, Lillian, I'm so glad that you asked this question. And I've heard from many people like you, Lillian, who have gotten the J&J shot and have been wondering what they should do for their booster. I agree. A lot of times when you hear the news, it seems like they're primarily talking about Pfizer and Moderna and not enough about Johnson & Johnson. So let me tell you what the recommendation is for Johnson & Johnson. The good news is that boosters are available now for people who got the J&J shot. And if you got your Johnson & Johnson shot 2 months ago or more, you are eligible for that booster. Now, you could get boosted with Johnson & Johnson if that's your preference, or you could get boosted with a Pfizer or Moderna shot. A lot of people are sort of choosing what works best for them, but what the trials have shown is that if you get the Johnson & Johnson vaccine as your booster, then you will have a significant increase in your protection against COVID. If you get the Pfizer or Moderna vaccine as your booster, then you will also have a marked increase, a really big increase in the antibody levels, which are the soldiers, if you will, that protect your body from COVID-19 infection. So whichever path you go down, you will get more protection than you have right now. And again, if you're more than 2 months out, I would urge you to go ahead and get that booster as soon as you can. You can get it at the same place that you got your J&J shot, most likely, and any pharmacy. A lot of doctors' offices have the vaccines now. And if you're not sure where to go, you can check out vaccines.gov on the internet, and that just put in your zip code there. It'll give you locations where you can get an additional booster.
Okay, very good. Thank you for that. Jesse, let's take another call.
Yep, our next caller is going to be Michael from California.
Hey, Michael, welcome to our program. Go ahead with your question.
Hi there. If someone has received 3 doses of the vaccine that takes an immune suppressive medication, is it safe for that person to attend an indoor performance such as a play or a musical? Okay, thank you.
What do you say to that, Dr. Murthy? Any advice if people have been vaccinated but want to attend indoor events?
Well, it's a great question, Michael. And if I heard Michael correctly, I believe he said he was immunocompromised.
Yes.
As well. If you are immunocompromised, we know that in general that means that you're at higher risk. First of all, you should absolutely get the vaccine. The CDC has also authorized people to get an additional dose, a third dose if they got 2 doses of the mRNA vaccines, at the third dose, to make sure that they get an extra boost, if you will, in terms of protection. And on top of that, you are eligible, like everyone else, for a booster shot when you're 6 months out. And so I would urge people to do that. But when it comes to what is safe, afterward, we know that Some folks who are immunocompromised will mount a really good response, to the vaccines, but others may not. It depends in part on things like how immunocompromised are you? Are you, for example, on a low dose of steroids, or are you on some very powerful chemotherapeutic medications that may suppress your bone marrow and your production of immune cells? So if you have questions just about how much at risk you are, given specific, illnesses you may have, you can always talk to your doctor to get advice. But if you are concerned, I would certainly say that if you're going to attend an indoor gathering, making sure that you wear a high-quality mask would be a good idea. That could be an N95 or a KN95 mask. Making sure that you're washing your hands well, carry some hand sanitizer with you, and then get out as quickly as you can. But I would probably err on the side of safety, especially if you have a serious immune condition that reduces your protection.
Okay. Jesse, let's take another call.
Yep, our next question is going to be from Glenda in Florida.
Hey, Glenda, welcome to our program. Go ahead with your question.
Thank you so much. My question is, if you've had COVID and you had a very mild case of it, my son and his family had it last winter, very mild. They don't think they need to get the immunizations. My opinion is I think they do. They said a study out of Israel said people that had had the COVID had a higher immunity than people who had the immunization. I just need clarification on that.
Dr. Murthy, can you help with that?
Absolutely. Glenda, I'm so glad you asked this question because you're not the only one who has it. And the bottom line is you are right, and I'll explain to you why. It turns out that people who have prior infection from COVID, they do mount an immune response, and that does give them some protection against future COVID episodes. Now, the big question, though, Glenda, is how much protection do they get? How long does that last? And does the amount of protection differ based on how old they are, how severe their infection was, or what other medical conditions they have? One thing that we have seen in the data, which is interesting and somewhat concerning, is that especially for people who have milder infections like your son did and his family, the amount of protection they develop in terms of antibodies is quite variable. Some develop a high degree of protection, but there are many who don't. And so I would be, concerned, if your son and others in your family had a mild infection last winter, meaning almost a year ago, that they may not have adequate protection right now. It's one of the reasons, given how many open questions there still are about the protection you get from prior infection. That's the reason that myself, the CDC, and many other scientists inside and outside government have highly recommended that people pursue the path of vaccination, because that is the tried and true pathway to getting maximal protection based on what we understand today. Now, could that change down the line as we understand more? It might. But for right now, based on what we understand, vaccination is the pathway to go down. Finally, let me just say one thing about that Israeli study that your son pointed out, because it's a reasonable question to ask. The Israeli study showed that there was a significant protection that folks with prior infection got. But we should always be cautious, and I would say a little bit suspicious about relying on a single study to tell you what's really going on. We've actually done broader analyses looking at papers from all over the world that have been published on the impact of prior infection with COVID-19. And they show actually significant variability. Some have shown that overall you seem to have decent protection, but if you're in an older age group, you actually have markedly less protection from prior infection. Others have showed, again, that if you have severe infection, that you get a lot of protection, but if you only had mild infection, protection is much more variable. And so given all of these, looking at all the data in totality is why we've come to this recommendation that even if you had a prior infection, it still makes sense to get vaccinated and not to rely on that prior infection to protect you from COVID.
Okay, Dr. Murthy, thanks so much. Go ahead.
Bill, one last thing to mention to Glenda, just so it might give your son some additional comfort, is there is now very clear data from Kentucky, from New York, and other places that tell us that if you got prior infection and you get vaccinated on top of that, you really boost your protection to very, very high levels. In fact, you're looking at people who are infected with COVID-19 in the past. Those who didn't get vaccinated were more than twice as likely to get reinfected with COVID compared to those who did get vaccinated.
Very interesting. Dr. Murthy, thank you so much for that clarification and for all of your time today. This has been a really informative discussion. And thank you, our AARP members, volunteers, and listeners for participating in the discussion. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others, while taking care of themselves. All of the resources referenced today, including a recording of today's Q&A event, can be found at aarp.org/coronavirus beginning tomorrow, November 19th. Again, that web address is aarp.org/coronavirus. Go there if your question was not addressed, and you'll find the latest updates, as well as information created specifically for older adults and family caregivers. We hope you learned something that can help keep you and your loved ones healthy. Please join us again December 9th at 1 p.m. Eastern Time for another live event answering your questions about the coronavirus. We hope you can join us. Thank you and have a good day. This concludes our call.